End-of-life care is so very important, and maybe it's something we're thinking more about with so many of our elderly fellow citizens being in a situation where they're locked in, isolated from family and friends. Today we're talking to the Shan Landry from Prairie Hospice to talk about end-of-life care and some of the issues related therein. So first of all, Shan, thank you for speaking with us today.
It's a pleasure to be here, Jeff.
So first of all, before we go forward and talk about some of the things that the organization does, tell us a little bit about the background, if you don't mind, of Prairie Hospice, because it's not a new organization in the community. What is Prairie Hospice?
Well, essentially, we've been going for almost 9 years now, and Prairie Hospice is what we would call a hospice without walls. Most people are used to the idea of a hospice being a residential facility where people go to stay during their terminal illness and receive care. What Prairie Hospice Society does is we pair up volunteers, trained volunteers, to be with people in the community who are facing advanced illness, terminal illness, and to assist them and their families through that by partnering them up with a companion who will do anything that's non-medical that they require. So it is essentially hospice without walls.
And I would think, too, having those trained volunteers would also take a great, particularly when people are in their own homes, would take some of the weight, some of the burden off of the long-term caregivers, which are often spouses or family members.
Absolutely, Jeff. You've hit it right on. In terms of respite, many people want to be able to die at home, surrounded by their family and friends, and it can put quite a strain on everybody, especially if they need a lot of care. But one of the other interesting things that Prairie Hospice has found with the people who've been referred to us over the years is about 20% of our clients are actually people who do not have family in close proximity or friends who are able to help out. So they are, as you stressed earlier, people who are quite lonely and isolated, and pairing them up with a volunteer, someone who can assist them with whatever they think is important in this last period of their lives, and able to help them and accompany them on that journey, whether it's a cup of coffee and just a chat, or whether it's something like organizing your recipes from way back so you can leave it for your nieces and nephews after you're gone. Anything along those lines our volunteers would do, and combating the illness and some of the fear related to being alone or on your own when you're very ill.
Now, you certainly bring up the compassionate and the benefits therein of being emotionally connected to these people and providing some emotional support during their last days and weeks. But let's talk a little bit about it. It sounds, in some respects, crass to talk about this, but let's talk about the financial side of this, because I know you've been doing some research that has shown that when people assist organizations like Prairie Hospice, there is an actual financial benefit.
There is, actually, and the first thing we always stress with people is that our service has no cost to the clients, families who use it. And we are funded entirely by donations. And we've had some very kind and generous donors over the years. But as we started to have a look at, are we effective? Are we using the money that's been donated appropriately? And how can we convince the people that want to invest in us, whether it's long-term funders or donors, that is really, in terms of, not to be too crass, but can they get a bang for their buck, knowing their investment is making a difference? So for years, we built our program based on the idea that we were getting good feedback from clients and families. They were saying to us, this made a difference, this was wonderful, it was great. But that's not really something you can take to the bank. Is there some way we could measure it? So about a year ago, we teamed up with the Community University Institute for Social Research. It's called CUISAR for short, which sounds a bit awkward. But CUISAR, with part of the University of Saskatchewan, has some very professional, well-trained researchers who've been working with something called a social return on investment analysis. And what they do, or what they did for us, was they interviewed clients, families, volunteers, board members, people who refer, family physicians, client-patient access services, and they asked a lot of questions about the effectiveness and efficiency of Prairie Hospice involvement with clients, and then they put an actual number to it. They were able to, using some well-researched dollar figures, be able to say, for example, if Prairie Hospice volunteer and the client themselves were able to agree that actually by having them involved, they saved 3 or 4 nights in hospital. They were able to stay at home because they had this companionship, or they didn't make a trip to the emergency room, or they got a ride somewhere. There's a value to that. And Cuisar did that all and told us that essentially, on a very conservative estimate, for every dollar of investment for Prairie Hospice, there's a return of $3.46 up to $11.68. So for every dollar we spend, the return to our clients, to the community, to the health system is pretty significant. And we're using that now to plan our future services.
All right. We're just out of time now, Shan. We have to leave it there. But if people want to get in touch with Prairie Hospice, either to find out about the services or, as you were mentioning, to donate or invest in the organization, how do they do that?
Yeah, they can look at our website, www.prairiehospice.org, or they can simply call the office, 306-249-5554.
All right. Thanks very much for speaking with us today.
Thank you very much, Jeff.